Visit licensureexams.com and try our samples completely free of charge.
Hey there, therapists. Welcome back to Demystifying Disorders, where we break down what you need to know for your upcoming licensure exam. I'm Eric Twachtman, and today we're going to take a good look at dependent personality disorder. This is definitely a condition you'll need to understand for your exam, so let's get right into it. Let's start with the diagnostic criteria from the DSM. Dependent personality disorder is characterized by a pervasive and excessive need to be taken care of, leading to submissive and clinging behavior and fears of separation. This pattern begins by early adulthood and presents in various contexts. To meet the criteria, a client must show at least 5 of the following: difficulty making everyday decisions without excessive advice from others, needs others to assume responsibility for major areas of life, has trouble expressing disagreement due to fear of loss of support, struggles to initiate projects independently, goes to excessive lengths to obtain support from others, feels uncomfortable or helpless when alone due to fears of inability to care for self, urgently seeks another relationship when one ends, and is unrealistically preoccupied with fears of being left to care for oneself. It's worth noting that these symptoms must cause significant distress or impairment in functioning to warrant a diagnosis. And another mental disorder or medical condition cannot better explain them. Clinical presentation. When it comes to the clinical presentation of dependent personality disorder, you'll notice several key characteristics in your clients. They'll often present with a pattern of relying heavily on others to make decisions for them, ranging from minor everyday choices to major life decisions. You might observe a client who consistently defers to their spouse, parent, friend, or even to you as their therapist for guidance on what they should do. These clients frequently express an intense fear of abandonment and may become extremely anxious or panicked when relationships are threatened. In your sessions, you might notice them agreeing with you excessively or being hesitant to express any opinions that could create conflict. They'll often describe themselves as helpless without others and may come to therapy precisely because a significant relationship has ended or is at risk. Another common presentation is the tendency to tolerate mistreatment or abuse from others because they fear being alone more than they fear the negative consequences of remaining in harmful relationships. They may describe past or current relationships where they've endured poor treatment because they didn't feel capable of being on their own. In the therapeutic relationship, these clients might become overly attached to you, seeking reassurance frequently, wanting longer or more frequent sessions, and struggling with boundaries. They may try to please you and be the good client rather than engage authentically in the therapeutic process. Differentials. When considering dependent personality disorder, you need to rule out several differential diagnoses. First, let's look at borderline personality disorder. While both involve fear of abandonment, clients with borderline personality disorder typically show intense emotional reactivity, impulsivity, and identity disturbance that aren't characteristic of dependent personality disorder. Borderline clients often alternate between idealization and devaluation of others, whereas dependent clients tend to consistently idealize those they depend on. Avoidant personality disorder is another important differential. Both involve social inhibition, but the motivation differs significantly. Clients with avoidant personality disorder avoid relationships due to fears of criticism and feelings of inadequacy, while those with dependent personality disorder actively seek relationships despite potential criticism because their fear of being alone outweighs their fear of rejection. Histrionic personality disorder can sometimes look similar due to the attention-seeking behavior, but histrionic clients seek attention through dramatic seductive behavior and are often more comfortable in the spotlight. Dependent clients seek attention through expressions of helplessness and neediness, preferring to remain in the background of those they depend on. Finally, consider adjustment disorder with depressed mood. Temporary dependent behaviors might emerge during stressful life transitions or losses, but these should resolve as the stressor diminishes. Development and course. Dependent personality disorder typically has its roots in childhood and adolescence, though it's usually not diagnosed until adulthood. Developmentally, you'll want to look for childhood patterns of excessive parental overprotection or authoritarian parenting styles that didn't allow for age-appropriate autonomy and decision-making. In some cases, childhood illness or disability might have reinforced dependence beyond what was necessary, creating a pattern that continued into adulthood. Cultural factors can also play a role, as some cultures value interdependence more highly than others, so you'll need to consider cultural context when making a diagnosis. The course of this disorder tends to be relatively stable throughout adulthood if left untreated. Major life transitions can exacerbate symptoms, particularly when a client loses a significant relationship through death, divorce, or separation. These periods often precipitate clients seeking treatment as they struggle to function independently. As clients age, they may face additional challenges if physical health issues create actual dependencies, making it harder to distinguish between necessary support and psychological dependence. However, with appropriate treatment, many clients can learn to function more autonomously and develop healthier interdependent relationships over time. Associated features. Beyond the core diagnostic criteria, clients with dependent personality disorder often display several associated features that you should be aware of. They frequently show low self-esteem and self-confidence, consistently undervaluing their abilities and overestimating the difficulties of managing on their own. This contributes to their reluctance to pursue goals independently. Passive-aggressive behavior may emerge when direct expression of needs or disagreements feels too risky. For example, a client might forget to complete a task they didn't want to do rather than refuse directly. They often exhibit pessimism about their capabilities, frequently using phrases like "I can't" or "I don't know how" before attempting tasks. Decision paralysis is common, with clients becoming anxious and overwhelmed when forced to make choices without guidance. You might notice they bring even minor decisions to therapy sessions seeking your input. They may also display a pattern of becoming the helpless one in various social contexts, reinforcing others' perceptions of them as needing care and protection. Many clients with this disorder also struggle with assertiveness, having difficulty saying no or setting boundaries in relationships. This can lead to exploitation by others who recognize and take advantage of this vulnerability, creating a cycle of unhealthy relationships that further reinforces their dependencies. Common comorbidity. Dependent personality disorder frequently co-occurs with several other conditions that you should be ready to identify. Anxiety disorders, particularly generalized anxiety disorder, are common comorbidities. The pervasive worry characteristic of GAD often centers around fears of abandonment or inability to cope independently for clients with comorbid dependent personality disorder. Major depressive disorder is another frequent comorbidity, especially following the loss of a significant relationship. When a client with dependent personality disorder loses someone they depend on, they may experience profound depression beyond typical grief responses due to both the emotional loss and the practical challenges of managing alone. Other personality disorders that commonly co-occur include avoidant personality disorder, as both share features of insecurity and fears of insecurity and fears of negative evaluation, though with different behavioral manifestations. Borderline personality disorder can also co-occur, with abandonment fears as a common feature between the two conditions. Somatic symptom disorder sometimes develops in these clients, with physical complaints becoming a means of eliciting care and preventing abandonment. You might notice that somatic symptoms worsen when relationships are threatened or when greater independence is required. Substance use disorders can develop as a maladaptive coping mechanism for managing the anxiety associated with real or perceived abandonment. Clients might use substances to reduce inhibitions in social situations or to self-medicate feelings of loneliness and helplessness. Therapeutic approach. When working with clients who have dependent personality disorder, your therapeutic approach should balance acceptance and challenge. Cognitive behavioral therapy offers a structured framework that can be particularly effective. Within this approach, you'll want to identify and challenge core beliefs about helplessness and inability to function independently while gradually building skills for autonomous functioning. Psychodynamic therapy can help clients understand the origins of their dependent patterns, often rooted in early attachment experiences. This approach focuses on exploring how past relationships have shaped current expectations and behaviors. The therapeutic relationship becomes a safe space to examine dependency needs and work through fears of abandonment. Schema therapy addresses early maladaptive schemas like dependence, incompetence, and abandonment that underlie dependent behaviors. You'll help clients recognize how these schemas developed as adaptations to childhood experiences and work to develop healthier adult modes of functioning that balance autonomy and healthy interdependence. Interpersonal therapy focuses directly on relationship patterns, helping clients develop more balanced ways of connecting with others. This approach can be particularly useful for addressing the social consequences of dependent behavior and developing skills for more reciprocal relationships. Regardless of your primary theoretical orientation, maintaining appropriate therapeutic boundaries is essential. Clients with dependent personality disorder may attempt to create an overly dependent relationship with you, so being consistent and predictable while gradually encouraging appropriate autonomy within the therapeutic relationship model's healthy relationship dynamics. Evidence-based treatment. For dependent personality disorder, several evidence-based treatments have shown promising results. Cognitive behavioral therapy has substantial empirical support, with research showing its effectiveness in reducing dependent behaviors and increasing autonomy. The focus on identifying and challenging maladaptive thoughts about self-efficacy provides concrete strategies for change, while behavioral experiments give clients opportunities to test their ability to function independently in gradual, manageable steps. Schema-focused therapy has also demonstrated effectiveness, particularly in addressing the early maladaptive schemas that maintain dependent patterns. Research shows that helping clients recognize and modify core schemas of helplessness and abandonment leads to more lasting change than approaches that focus solely on current behaviors. Mindfulness-based interventions have shown promise in helping clients tolerate the anxiety that comes with increased independence. Studies indicate that developing mindfulness skills helps clients observe their dependency-related thoughts and feelings without automatically acting on them, creating space for new behavioral choices. Group therapy provides valuable opportunities for clients to practice interpersonal skills in a supportive environment. Research supports the use of skills training groups that specifically target assertiveness, decision-making, and healthy boundary setting, all areas of difficulty for clients with dependent personality disorder. Dialectical behavior therapy, while originally developed for borderline personality disorder, has components that research shows can be beneficial for dependent clients as well. The interpersonal effectiveness and distress tolerance modules help clients develop skills for healthier relationships and for managing the anxiety that comes with increased autonomy. Interventions. When working with clients who have dependent personality disorder, several specific interventions can be particularly effective. Gradual exposure to independent decision-making helps clients build confidence in their judgment. Start with small, low-stakes decisions in session, then gradually progress to more significant life choices, processing the anxiety that emerges along the way. Assertiveness training addresses the difficulty these clients have in expressing their own needs and opinions. Role-playing assertive communication in session provides practice for real-world situations, helping clients find their voice in relationships that may have previously been very one-sided. Teaching problem-solving skills gives clients a structured approach to challenges they might previously have avoided or deferred to others. The framework of defining the problem, generating multiple solutions, evaluating options, implementing a solution, and assessing the outcome provides a concrete process clients can follow when facing difficulties. Social skills training helps clients develop more balanced relationships. Many dependent clients lack experience with reciprocal relationships, so teaching appropriate self-disclosure, active listening, and how to both give and receive support can transform their social interactions. Anxiety management techniques are essential since fear often drives dependent behavior. Teaching diaphragmatic breathing, progressive muscle relaxation, and cognitive restructuring gives clients tools to manage the distress that comes with increased independence, making it more likely they'll persist through challenges rather than retreating to dependent patterns. Assessment instruments. When assessing for dependent personality disorder, several instruments can provide valuable information. The Structured Clinical Interview for DSM Personality Disorders, SID-5-PD, offers a comprehensive assessment of all personality disorders, including a specific section for dependent personality disorder that guides you through evaluating each diagnostic criterion systematically. The Personality Diagnostic Questionnaire 4, PDQ-4, is a self-report measure that screens for all the disorders. The Dependent Personality Subscale identifies clients who warrant further assessment, though you'll need to follow up with a clinical interview, since self-report measures alone aren't sufficient for diagnosis. The Interpersonal Dependency Inventory specifically measures various aspects of interpersonal dependence, including emotional reliance on others, lack of social self-confidence, and autonomy. This can be particularly useful for tracking changes in dependent features throughout treatment. The Relationship Profile Test assesses 3 dimensions relevant to dependency: destructive overdependence, dysfunctional detachment, and healthy dependency. This nuanced approach helps distinguish problematic dependency from healthy interdependence, which can guide treatment planning. The Milan Clinical Multiaxial Inventory includes a dependent personality scale that can be useful both for initial assessment and for monitoring progress. It places dependency in the context of overall personality functioning, helping you understand how dependent traits interact with other personality features. Here's a question to test your understanding. A client with dependent personality disorder has been in therapy for 6 months and has made significant progress in making independent decisions and setting boundaries. Recently, their long-term partner threatened to end the relationship, and the client immediately reverted to extremely dependent behaviors, agreeing to all the partner's demands. Which of the following represents the most appropriate therapeutic intervention at this point? A. Focus on processing the client's fear of abandonment before addressing the dependent behavior. D. Confront the client about their regression and remind them of the skills they've learned. C. Suggest a temporary separation from the partner to reduce the dependency triggers. D. Use the current relationship crisis as material to reinforce previously learned skills. The correct answer is D, using the current relationship crisis as material to reinforce previously learned skills while acknowledging the intensified anxiety. This approach recognizes that regression under stress is common, but uses the real-life situation as an opportunity for growth. Answer A might be helpful, but addresses only one aspect of the problem. Answer B is too confrontational and fails to acknowledge the normal anxiety response. Answer C is too directive and removes an opportunity for in vivo learning. Summary and key takeaways. As we wrap up our discussion on dependent personality disorder, remember that this condition is characterized by a pervasive pattern of dependent and submissive behavior driven by an excessive need to be taken care of and fears of separation. The development of this disorder often traces back to childhood experiences that didn't allow for age-appropriate autonomy, including overprotective or authoritarian parenting styles. Differential diagnosis is important, particularly distinguishing dependent personality disorder from borderline, avoidant, and histrionic personality disorders, as well as from temporary dependent behaviors that might emerge during adjustment to stressors. Evidence-based treatments include cognitive behavioral therapy, schema therapy, and interpersonal approaches that balance acceptance of clients' genuine needs for connection with challenges to their beliefs about helplessness. Specific techniques should focus on building skills for independent functioning, including decision-making exercises, assertiveness training, and anxiety management strategies that help clients tolerate the discomfort that comes with increased autonomy. Assessment should be comprehensive, using both structured interviews and standardized measures to evaluate the extent of dependent features and track progress throughout treatment. The goal of treatment isn't complete independence, but rather healthy interdependence, the ability to form mutual relationships while maintaining appropriate autonomy and self-direction. That's all you need to know and remember. It's in there